Hi, I'm Dr. Priya Matthew from MVP Family Dental, and we get a lot of questions about dental crowns, so I'd like to address some of those so that you have more information about them. So dental crowns are a kind of covering that goes over your tooth to protect your whole tooth from breaking. So say you have a large filling, or you've had let's just leave it at a large filling. You would want to sometimes protect that with a dental crown, not because you're royalty, but because, well, you are royalty, but also because you want to protect the whole tooth from breaking. There are several different types of crowns, but usually what we use in the office is a type called zirconium crowns. They're made of a really strong material, but they look like porcelain. There's also porcelain crowns and porcelain infused to metal crowns, which is basically metal and then porcelain on top. But a lot of times they tend to chip and then the metal shows through. So the little bit more newer option for crown material is zirconium. Okay, so the advantages of zirconium are that it's a very strong material, so it will last, and it can last when people are bruxers, which means they like clench really hard. It can hold better than, say, porcelain, which is another type of material that you can use for a crown. But sometimes we use the porcelain in the front because it's a different look. It's, looks more natural. But the zirconia in the back crowns, we like to use that because it's a lot stronger and they look like teeth. So the dental crown procedure starts with somebody who has a very large filling on a tooth that could probably break on its own if we don't protect it with a crown. So say this patient comes in, they have a large cavity or an existing filling that's very large from a large cavity in the past. We remove the decay, which is what we call the cavity, or we remove the old filling and we refill. And so now we have a tooth with big filling, and then we prepare the tooth for a crown by going around the crown on the top and the sides, by going around that tooth to make about like 1.5 millimeters of space for a dental crown to be placed on top. So basically you come in, you get the crown prepared, which means we take off some material around the tooth, your tooth in your mouth, and then we send an impression to the lab. The lab makes the crown, and then you come back in a few weeks and we cement the crown in. You leave with a temporary crown for the first visit, and you come back, we take off the temporary crown, we put on the permanent crown. No, it does not hurt. The dental crown placement does not hurt because we make sure you're nice and numb before we put on the crown, so you shouldn't have any pain. So sometimes it's worth putting children's teeth in crowns if they have really large cavities that go down to the nerve. We sometimes have to put stainless steel crowns on top, but usually that's a pediatric dentist. Usually a pediatric dentist would put those crowns on, but we could refer you to a pediatric dentist if that was the case. You can get cavities underneath where the crown ends sometimes if there's a little bit between your gum and your tooth is exposed a bit between the crown and the gum. You can get some decay on that tooth area, so you do have to be very good at your home care. You have to make sure you're brushing, you're flossing, and that you're coming in for your regular checkups so we can make sure everything is good. You can expect a dental crown to last at least 5 years to 10 years, if not more. It all depends on how well taken care of they are and how often you're coming in for your checkups. Many times insurance covers dental crowns. Again, it depends on your insurance, what kind of insurance, how much coverage there is, but we do look into all of that for you, and we give you a price before we start any treatment. You can make an appointment by calling us at our office, and we can get you in for a consult to see if you need a crown.